So I really wanted to get involved with the My Epilepsy Story organization because of one person. Her name's Brandy Parker McFadden, and she really is a dynamic person who I met and was really impressed with. Her energy, her passion, her dedication for the mission that didn't exist before she got into the space. You know, you spend some time with Brandy and you realize that this is an important thing that we all need to be doing. But it's her energy that keeps us going, and it makes it easy to say yes to. So it's really because of her. I think what's really great about My Epilepsy Story, you know, it's the only nonprofit for young women and for women and young girls. And that's an important area that we need to help address. There's a big gap. I will be honest with you, we don't have a lot of great resources for this group and population. And it's important that we have resources such as My Epilepsy Story that allows women to go to one place, they feel comfortable and they know they're going to get accurate and really good information. You know, the adolescent female patient from a doctor is one of my most special environments, and it's because there's so much that goes into caring for them. But now I have an opportunity to direct them to a resource that can be used for their education and their improvement of care, and that's a really neat thing for me to be able to do. So let me explain the quality measure for parents and for patients, specifically adolescent females. What this measure is for is to ensure that your medical provider will follow the necessary steps in a very organized fashion to be sure that your care is not just dropped, but it's properly transitioned to your new adult provider. And that's a very important process because adolescents, and specifically females, are getting very comfortable with their neurology providers. We've honestly developed a long-term relationship. We've become part of their families for a long and many years in some cases. And to suddenly have that relationship end is very scary, very trying. So if you do follow this measure and it does take you through the steps correctly, then what you're going to see is it's going to be easier. It's going to be done right, and you're going to be a lot happier at the end. I think this quality measure on transitioning adolescents to adult care is really important and necessary for the patient, and specifically, again, the adolescent female, because there are a lot of special circumstances that go into caring for an adolescent female. And those activities or issues need to be handled properly. And we have to make sure that we don't just stop and pass them on. It's really important for the patients that they know that us as providers are doing the things in the best way we can, and ensuring that those special issues and those important aspects of their care are being properly given to their new adult provider, who will carry that on, and there's no drop in the quality that has been given for the care. I think, you know, adolescent females can be really helpful in the process of what occurs during transition. Specifically, I really want them to be involved. I want them to know what's going on with their care. That's an actual big aspect of one of the 6 areas. We call it transition readiness. And to help get ready, we want all of these adolescents and these young women to really be directly involved with their care, know their medicines, know when to take them, know to take folic acid if it's for women with seizures. You know what the counseling is recommended out there, so we can work together to make sure that the information is learned and remembered going forward. Yeah, I think a lot can be done for the young adolescent female to be sure that this measure is properly followed. And I know if we educate our patients to know this measure exists, then they can be proactive and ask their provider, are you following the 6 steps? Even go to the step of looking it up on gottransition.org. They're there, or even going to the American Academy of Neurology website or Child Neurology website to actually look at this measure of transitioning to adult care and see the specifics behind the 6 components. And again, make sure that your provider is actually following them and doing them. Be active, be proactive. The better educated our young women are on exactly what has to happen, I promise you the provider will do a better job with it, making sure that they are compliant with that. Yeah, one of the concerns we have is, what if you don't want to switch? You know, you've gotten so comfortable, we have a great relationship, we have a great rapport, what do you do? And it's hard. I want all women to know that it's not because we don't care anymore. We do. We love you. We have had a great relationship with you over time and do deeply care. But unfortunately, there's many more providers that can see you now that you're entering adulthood, where there isn't as many providers that are going to be able to see the 5-year-old who's waiting for seeing me or seeing somebody like me. And so for us as neurology providers, or specifically us as pediatric epileptologists, I can't get those younger kids in if I don't have a mechanism of moving you onto adult world. The other thing is adult neurology providers are going to be more up on exactly what is going on as you go into adulthood. I don't do any of that, and so I tend to be very, immature in that regard, if you want to use that word, because I focus on all the pediatric aspects. As you go on in your life and want to start a family and go to college, get jobs, the adult providers are very used to that circumstance, where I'm used to you being in school. Well, that's going to obviously end, and so therefore we want to make sure that we do what's best for you. And those are the major reasons why I think it's important that you accept what we're trying to do, but do it with us together so we do it correctly. Yeah, one of the things is that we're going to recommend that you transition to an adult neurologist, but what if you go there and you don't like them? That is okay. You do not have to pick that person. A lot of centers have relationships with their adult colleagues because we want to make sure we have proper communication. But by no means you should think that this is the only person for you. If you don't click or you didn't like the environment, you can call us back and say, hey, I didn't like that certain provider or certain institution. What else can you recommend? And we'll work with your next choice. The more you're active on the process, though, the better it's going to be. One of the aspects of proper transition is that you get comfortable with the provider, the adult provider, prior to actually leaving us, whether that's in person during our visit or on the screen like telemedicine or in other aspects. We want you to be as comfortable with the decision as possible. But we also want you to have an active say. This is your opportunity now. If you would prefer to be seen by a female adult neurologist, some young women would prefer that. That's absolutely fine. We can again tailor that. You may not have that preference, and that's okay too. The proper choice of an adult provider really depends on where you're going to be. So let's just say the scenario is you're going to go to college. Is it better for your adult provider to be in your hometown, or is it better for your neurologist to be where your college is? And I really think that's a matter of choice and what you're comfortable with. Some of it is dictated by distance. So for example, if you are going to a school that's super far from your hometown, perhaps then a hometown neurologist isn't the best person for you, and that somebody at your local or closer to your institution of learning is going to be that person for you. It's also okay to have two. It's also okay to establish relationships with somebody in the center where you're close to as far as your school location is, and then during the summertime, be reestablished with your hometown neurologist. The reality is for young women, they're going to go across this United States and they may not come home after college is even over. So I really want that decision to be theirs. And most importantly, have that conversation with your mom or your dad or your caregiver to be sure that they're comfortable. It's a very difficult time for your parents. They're not used to having you go, and to let go of you is very difficult, but make sure they know that you are mature enough that you can make these decisions and that it's your decision to make. Ultimately, at the end, we like their input, but it is your decision. So yeah, I think one of the important aspects of transition for young women is knowing and being able to pick up their own prescriptions. So the first thing you have to do is familiarize yourself with when you're supposed to take the medicine, but then know when your refills are going to come to an end and when you need to go get them. So one of the 6 steps is what we call medication readiness. And part of that is we're going to ask these young ladies to actually be responsible for calling the pharmacist and getting that refill made, or that prescription refilled. Or if you're going to be running out and you're out of refills, you got to call us. But it's going to be you as a young lady to call us and ask for that refill, no longer your mom or your dad or your loved one. It's going to be your responsibility, and that's a really important part. The other important part is not just your prescription medicines. Make sure you have enough folic acid, that you know where it is, that you're taking it every day, and when it gets low, go to your local pharmacy or drugstore or convenience store of where you purchase that product and make sure you get it. Now, many of the women will need a prescription for folic acid. We do like to recommend a little higher dose than what's normally recommended. For that reason, if you need a prescription, again, you're responsible for that prescription. So make sure that you know when the refills are going to end, know when you're getting low on your doses, and be proactive. Don't run out. Yeah, I think there's lots of things I would want a young adolescent or young female to know, or a young woman who's really going into adulthood. Know that you're very strong, you're very proud. We love you. We think the energy that you all produce is really important. Be a hero, be a spokesperson, get your message out there, whether it's, you have epilepsy. It's okay, you're not different. You're special in a way of being powerful. Use it to your advantage, but please help all those other young women that are coming ahead of you and help them with the process that you are now just finishing. Meaning that when you go to your adult neurology care or you're leaving us as pediatrics, you're a young woman now, you're 18, you're 21, but there is a 12-year-old that's just starting her journey. What can you do to help that young lady in her beginnings? That's how we're all going to get through this, and we're going to decrease the stigma, and we're going to get ahead with epilepsy care. You have a responsibility now as much as we do, but that responsibility, really, you can do it, and we know you can.